So going back to your personal case, what was the next step after that initial diagnosis?
In the January, I had that 20-minute operation under a local anaesthetic. I was very puzzled because there was an awful lot of pushing and pulling going on here. It was never explained.
Was this in the hospital?
In the hospital, in the theatre.
In this hospital, yeah.
Yes. I really didn't understand, and it was not explained. I was told that I would hear from the hospital, and then sometime later I had a letter calling me back because they had found that it was quite serious. And then I was scheduled for major surgery.
Do you know how long the delay was in that case?
From the January to my operation was in the May. That operation was cancelled once. And after it was cancelled, I then started to bleed profusely. It erupted. I called out an ambulance one night, but they couldn't help me. And I was on the point of having the next date cancelled as well, but luckily that was, during the course of the day, reversed, and I was taken in.
Can you shed any light on the cause of the cancellation?
Well, no, not really. But from what I now understand, because in my most recent one, I was told I could go in and be prepared, but until 12 o'clock, they wouldn't even be sure there would be a bed available. So I would imagine it was more to do with having the space, the bed, and the nursing staff available on the ward after the operation.
Yes.
As far as the lead up to the operation is concerned, I know that things vary from surgeon to surgeon. Some find it easier to talk than others. And I will say that I had very little information available to me. Would you like me to tell you about that? I was drawn a little diagram. I'd never heard of parotid before, but I was told there were two surgeons. One said to the other, "Oh, we could do a flap." I said, "Well, what's a flap?" And he said, "We'll take a bit off your chest." That was it. So after the operation, to come round and to find that the flap was actually the pectoralis, that's right, major, the muscle that controls, because I can't get that arm up, and I am left-handed.
Yes, that is the chest muscle.
So that's all been pulled up, so my left shoulder now is 2 inches lower than the other one. I lost my ear, so my balance went. And that's been probably the most difficult part of my recovery.
So is it the case you'd prefer to have been further informed or warned about what was going to happen? Or are you saying that there could have been an alternative procedure that was perhaps not offered in quite the same way?
There was no discussion about any alternative, if an alternative existed.
Okay.
I have to trust professional adjustment in that respect. But I do feel, I think a lot depends on the character of the patient. Some people are frightened out of their wits and don't want to know.
Yeah.
Someone like myself wants to know the detail. I have to say, having gone through the army, the one thing that's been drilled out of me is fear. The fear has got to be concealed. I would rather know, I would rather be prepared.
So you're an information person. You'd like to be fully informed and hear exactly where things are at.
Absolutely. I mean, to come round after an operation and leaving hospital thinking, what on earth do I do now? You know?
So in general terms, do you think in the NHS and healthcare providers in general should be given a little bit more information than they do on average?
Yes, definitely.
And what about the information that's generally available out there on the internet, you know, that you can find by your own curiosity? Is that a compensation for that?
I don't know how I found it. I stumbled across the international website.
Yeah.
Parotid Patients Forum.
For the
and from there,
gland, yes.
In sharing information about what do you do about your teeth,
Yeah.
and all of that, and what sort of equipment like water pick, pressure jetting, and all of that.
was useful. So you got a lot of additional useful information from the kind of peer support website.
Oh, yes.
Did you have the backup from the hospital in terms of aftercare?
The backup from the hospital came from the speech therapist.
Yes.
And also the nutritionist.
Yes.
Nutritionist, I became quite addicted to Fortizan. My weight fell to way below what it was at the age of 18 when I went in the army. I still haven't got my full weight back.
This is a build-up drink that you're mentioning.
Yes.
Yeah. So you were using that to keep the weight as stable as you could anyway.
I tried to get my weight back up.
Yes, exactly.
At the same time, trying to find my balance.
Yeah.
The physio in the hospital, great. As soon as they realised that I could go downstairs step by step instead of falling from top to bottom, that was it. They gave me some exercises for my arm and so on. But in the main, it was speech.
So let's come back to the operation itself.
Yes.
Before we come on to how you've done afterwards. So the operation, what did they actually do during the operation, as far as you're aware?
I've asked to see the notes, and there's very little information there. The gland has been removed. My ear, I was told that they almost went down to the bone. Don't know what that actually means. And my left ear was removed, thankfully sticking out like a railway signal. Now I've got something I can put my driving glasses on without those falling off the end of my nose. So that basically, the nerve was cut. I now understand that it is fairly common procedure for the nerve to be grafted, but it may well be that there wasn't time, there may have been other pressures, there may have been medical reasons why that nerve wasn't grafted, and so on. So I've had to put up with the additional difficulties of losing muscle, losing nerve, with my eye drooping, and more importantly, the side of my mouth beginning to drop.
Yes.
And my skin has begun to stretch more and more. So food was falling out. I had to drink through a straw. I couldn't drink any other way.
So what have they said about these complications? Have you had to have further revisions of the surgery in order to address these complications?
Have I?
Had to have further revisions of the surgery?
Yes, 3 weeks ago. And it was at my request, and I can't praise the plastic surgeon enough. He's an amazing man. There were discussions about how the corner of my mouth could be lifted. At the same time, again at my request, a gold weight was put into my upper eyelid because I can now close my eye completely, and there's less chance of ulceration at night and so on. So, yeah, the surgery 3 weeks ago was to remove some of the excess flesh. It was low risk, non-invasive, and just full of stuff. Unfortunately, it's left a gap here. So I can't say my V's and V's. I tried to say to my wife, because I couldn't drink after the operation without trenching myself. I had to say to my wife, I need a baby's viv, and I had to say it several times before she knew. But to overcome that, my son rushed around and via courier got this remarkable thing to me, little hole in the top's ingenious. So I can put my finger there, put that into my mouth, measure how much I want, hold my head back. I could now drink.
Yes.
I won't die of thirst.
No, that's a nice, simple, practical solution.
Yes, it may well be, perhaps a little bit more can be done later.
Yeah.
Well, I begin to think I've had enough of surgery. It's 4 lots in 3 years.
So you had to have 4 procedures all together.
Yes.
Which is a lot of setbacks and then recovery periods.
And I'm no longer, you may have noticed, I'm no longer a young man. Also, there was a slight worry on my part because after the major operation I had 4 weeks radiotherapy.
Yeah.
And what you're told about radiotherapy, if I may say this, is that radiotherapy, the effects peak in a month and then tail off. No, they don't. Not in my case. I live with that every day. So every day I feel as though I've been kicked in the side of my face. But I comfort myself by always remembering there's so many people far worse off.
So what you're referring to there is the late effects of radiotherapy, which are increasingly known. Obviously, these are effects that go on for many months, perhaps years after the end of treatment.
Yes.
And in your case, when did the radiotherapy come to an end? In
July. I had my operation in 2011 in May. I had my radiotherapy in the July.
Right. So, but it's several years ago that you had the radiotherapy.
Yeah.
Because it's...
And of course, what was interesting, because I'd read so much about not having surgery after radiotherapy, but the surgeon here was quite confident that it was outside the arc.
Yeah.
And so far, so good. But I was very worried about having surgery after because of what I'd read.
Yeah.
Not that there's a great deal of information, because I've tried to research that.
Yeah.